Hello, you may remember my previous video in which I discussed mental health stigma. I'd like to read something else again actually about mental health stigma in the Springfield Hospital and other hospitals and amongst healthcare professionals in general, and also to refer again to the Stacey Dooley BBC Three Psych Ward documentary, which I featured in and which I did not ask to be featured in. And the issue of privacy is obviously at the heart of all I say, because whilst we might want to come clean with our family and friends about our mental health problems, we don't necessarily need all our psychical issues broadcast to the world. Thank you. I'll continue with my talk. In my previous video, I discussed how mental health stigma is possibly most high amongst mental health staff themselves. They seem to want some kind of leverage on you, and in my case, all they seemed to find was the false accusation that I was dirty. It is hardly helpful to call the victim of sexual assault dirty, as this clearly will not help any of their psychological state of mind. They make out that we with schizophrenia are the ones throwing the accusations, when in fact at times it is they themselves, that is the staff in mental health hospitals. Indeed, medical staff even throw accusations at each other. I have witnessed little spats amongst doctors, such as one child specialist saying that my psychiatrist was spiteful, while another of my healthcare professionals said that psychotherapists only do their job because they cannot get anything else. This point is evidenced, but in my view, by the fact that when I asked one such doctor, that is a doctor who also practiced psychotherapy, what schizophrenia was, they said it was like coffee grains grown through a filter. No one seems to know what it is. That is what schizophrenia is, although certain doctors are keen to point out that if it's a gene, it's certainly not one they have. Everyone seems keen to favour the schizophrenic, who also seems to have psychopathy, while telling the rest of us with schizophrenia that we are imagining things. All patients are put together in a ward, regardless of whether some are actively physically dangerous, and staff, contrary to being selfless in some people's opinion, lock themselves into a little room when a patient becomes angry, while the rest of us patients, with some fear, have to sit it out. Returning to the issue of Stacey Dooley's BBC Three Psych Ward show, I do not know how I could ever tolerate being filmed nude in a hospital, especially when getting a hip injection or having a possibly fatal seizure. She talks graphically in one of her YouTube videos about what a dead body smells like and how it feels to see a dead body. And owing to this fascination of the ill, I now have to consider necrophiliac acts even in a hospital, even in the form of photography, that is, if I should die in a hospital of a seizure, for example, and that could be a psychiatric hospital. Clearly, patients have to dress and undress in any hospital, and sneaking into rooms to film them, as you can see in the bit that I am in Psych Ward Dooley's, and waking up during a post-seizure sleep or passing COVID to them is hardly beneficial to any media outlet, even if they do put on their Mother Teresa act. For the record, I don't want Dooley to assist staff when it comes to my treatment. I have never seen anything so absurd as her dressing up in a uniform and trying to medically assist with staff. Thank you.